Good morning. Dr. Z here, welcoming you to another episode of our Oral Pathology Corner. Today, pretty quick and easy topic I'm going to be discussing, which is something called an eruption cyst. And as you can probably figure out from the name, an eruption cyst is a little cyst or little kind of balloon swelling that occurs around an erupting tooth and looks a little something like this. And as you can see, it's kind of a bluish purplish little swelling area that is caused by an erupting tooth just kind of having trouble making its way through into its proper position, and as a result, little pool of blood kind of creates a little blood blister between the top of the gums and the tooth itself, and creates that kind of unusual appearance that, if you're not sure what it is, can be kind of alarming. And the good thing with eruption cyst is most of the time they're going to resolve themselves. As that tooth continues to make its way up through the gums, eventually it'll come into place and the cyst will go away. Occasionally, very rarely, that eruption cyst will actually prevent the tooth from coming all the way through, and at that point in time, treatment is pretty simple. Just making a small incision in that eruption cyst to kind of allow that cyst to drain and create a more clear path for that tooth to come into place. And so that's pretty much all there is to an eruption cyst. A pretty simple topic, but one that does pop up in kiddos from time to time. And so if you've got a child and you notice something like that, just monitor it, as that tooth comes into place. Should only be, I would say, 2 to 3 weeks tops that cyst is there before the tooth comes into place. So if it's lasting longer than that, or even just, again, as a general rule, if you see something out of the ordinary, best to get into the dentist and have them take a look at it. But hope you found this informative. Thank you for tuning in, and we will see you next week on another episode of Tooth Teacher Tuesday. Have a great week, everybody.